Hi there, Dr. Brad Cole, one of the doctors with Cole Pain Therapy Group, and today I've got a video for you about lumbar spine first aid. So 90% of people at some point in their life is going to have a episode of back pain, and at any given time, 10% of people currently have an episode of back pain. So let's consider, if we're going to look at this from a first aid standpoint, let's consider what causes back pain. What are the best strategies to minimize an episode? And when is back pain dangerous? So, first, what causes back pain? Well, think about pain as simply an alarm system. Whenever there is a problem that causes inflammation, then that subsequently causes pain. It's your body's ability to let you know that something is not working correctly. So, if you are running down the street and you're wearing a shoe that is not fit properly, it's going to cause some pain. There's some tissue damage that's occurring there, and the pain system lets you know. If there were no pain in this situation, then someone could irritate their foot and certainly cause a bigger problem if it was completely numb. But the pain lets you know that there's a problem. The shoe does not fit correctly. When it comes to back pain, some people have been told that they have arthritis or scoliosis, some type of a structural problem. Now, look at this fence or this gate. It looks like it could have some structural problems going on, but we don't really know how it works. It's rather like the foot in the shoe. Um, you don't really know if the shoe fits well unless you start putting some miles in it. Similarly, with this gate, we don't really know if it works correctly unless somebody were to open and close it. Is it going to fall apart? Will the hinges work appropriately, causing the gate to open and close easily? We don't know. You have to move it and use it first. So that's the big difference between a structural problem where the whole gate's fallen over and a functional problem where the gate's looking okay maybe, and we don't really know if it's going to work until you use it. Now, most back pain is functional. There's no real structural damage, but rather it's functional. It's not working like it should, and that causes a bit of a wear pattern or an irritation that then causes pain. So think about that. Most back pain is functional. It's simply not working correctly. So when there's a case of spine pain or back pain, uh, it's associated with this mechanical alteration. It's not working quite like it should. Maybe a joint's not moving well, maybe a muscle's tightened up, perhaps both, but there's a mechanical alteration associated with that pain. When that happens to a person, the individual changes their behavior in a way to avoid the pain. Additionally, if that goes on for a while, such as somebody with back pain that decides to sit on the couch for a year as opposed to exercising, their spine becomes weaker, continuing to move in a poor way, causing more and more pain can further drive degeneration. So rather like that callus on the foot, if you don't change your shoe, you keep moving, it's going to develop more of a wear pattern. So across all the varieties of different ways to treat or manage back pain, most of those varieties fit into these four categories, and subsequently these four areas address an aspect of back pain, such as spinal manipulation. That's when a chiropractor uses their hands or a table to move the joints in a beneficial way. That can address the mechanical alteration. Rehab exercises that can strengthen the spine and get someone moving in a productive way again. Medication addresses the pain, like an anti-inflammatory and opiate medication helps to reduce the pain. And then advice and exercise. That is the solution for someone who is changing their behavior. Maybe they're afraid of the pain. And so when we educate them and then give them permission to move in a way that doesn't cause their back to hurt, then we can get them moving better again too. And so each of these four areas address this cycle or this big mess of back pain. In our office, we like to utilize the majority of these, and everyone's different. Some people have more of a fear issue and less of a spine weakening issue. So that advice and exercise really is what they need. Some people have simply an acute process that's going to go away in a day or two, and they can take a couple of a leave and then they're doing fine again. Other people have a strong mechanical aspect to their pain, and they do well with spinal manipulation or chiropractic treatments. And most people do well with some type of combination of all of these things. Now, some of these one can do on their own because we're still talking about lower back first aid. Some of these people can do on their own. Others, you really need to have a professional come in and help to give some advice and direction based on your specific situation. So let's look at some anatomy of lumbar spine stability or function. How is it supposed to work? Well, a lot of people talk about core exercises for back and core training. Well, the core is like a basket weave, a meshwork around your spine and around your guts. So when someone is trying to str strengthen their back up, we should work about core. We should work on core stiffening. The core should be stiff, and when someone's pushing or pulling or bending or reaching, all of that movement and strength needs to be around the hips and the shoulders, and the core acts as a stiff, like a stiff link between those two systems. We've got some more information with some other exercises or with regards to core training and preventing back pain with spinal strengthening on our website. But just briefly, think about the back is not needing to be super duper flexible, but rather in most cases needs to be stiff and stiffened appropriately by the core. Let's consider some first aid strategies. First, most back pain is not dangerous. Most beachgoers can play in the water without coming across a shark, but we need to know what to look for and what to keep our eyes out for. So here's a couple of examples of some dangerous or non-functional causes of back pain. Back pain that's not from a joint or muscle that's not moving correctly, but rather from a tumor or an infection, a kidney stone or an ulcer or an aneurysm. These are potentially very dangerous causes of back pain, but most cases of back pain are functional, not dangerous. Here's a list of some indicators when there's a shark in the water or there's a dangerous cause of that back pain. First, if someone has concurrent cancer or they're starting to lose weight and don't really know why, if they're on immunosuppressing drugs, a prolonged use of steroids, so a couple months with some prednisone can weaken your bones significantly, increasing your risk for a spinal fracture, even if it's not a significant trauma or a significant fall. IV drug use is associated with infections that can go to the spine, UTIs that worsen, need to be evaluated and treated effectively, or pain that is increased or unrelieved by rest. So if there's pain from a joint that's inflamed, like a finger joint that's inflamed, and it hurts to move it and you hold it still, it feels better. Similar with our back. If our back is worse when you're laying still, that is an indication that you need to be evaluated by a medical professional. If you have a fever, if you have significant trauma, any neurological issues such as bowel or bladder incontinence, numbness, major weakness, those nerve problems need to be evaluated very quickly, and especially if it's associated with back pain. Once again, most of these, most cases of back pain do not involve these, but we need to know what to look out for. Additionally, when someone has a functional back pain, sometimes those functional back pains end up being significant causes of disability, and a lot of it has to do with our psychology and what we think about and how we're approaching the pain. So if there's a negative attitude or you're fearful of movement, if someone only wants to take medicine and lay around and not be active with their rehabilitation, if someone is depressed or has social or financial problems, all of these stressors add up to affect the whole person. In our office, we like to look out for these things and help people meet their goals, help people along in a way that they're educated about their back, they have a plan that they're excited about for their back, and see how they can get better and better. And all of these other social and psychological problems can certainly affect someone's recovery. So something to keep an eye out for there. Not everyone is the same when it comes to their back. But when one does have some functional back pain, let's look at the initial treatment. Look at spine-sparing strategies, some ways to reduce the pain, move better, get the inflammation down, and heal up in a quick and positive way. So spine-sparing strategies. So if someone has back pain that hurts worse when they're bending forward, what we need to do is explore and play with different ways to move throughout their life so she can still pick up a bag of groceries without bending forward. So that takes some positive outlook and just moving differently to explore and see what can be done in a way that doesn't poke at that back sensitivity. Consider ice tape distraction, things like icy hot, biofreeze, rock tape, kinesio tape. Those things don't really change the how the back is working, but it certainly changes how the back feels. And if it feels better, we move better. We move better, we heal up quickly. All these are over the counter, easy to grab a hold of. Movement habituation. It's basically, this is good low back first aid, this exercise here. We'll have videos like this on our website, but he's getting to a position where his back is nice and decompressed on hands and knees, not a lot of compression there, and then he's playing with his back movement. And in this position, he can explore and feel what hurts, what doesn't hurt, what feels safe to him. It's great for boosting confidence. And if someone can't bend forward and backwards when they're standing up, if they go on hands and knees and it's decompressed and they can go through this movement, it helps the back to heal up relatively quickly. Consider also some anti-inflammatory strategies. Here's an interesting video that we'll put on our website too about it's about how pain relievers work and how anti-inflammatories work. But consider a couple of days of ibuprofen or Aleve, great nutraceuticals out there involving omega-3 fatty acids and flavonoids, those types of proteolytic enzymes that are really helpful for reducing inflammation and boosting up your healing. But anti-inflammatory strategies certainly good. From the pharmaceutical standpoint, good for a couple of days, maybe a short-term solution, not a very good long-term solution. But when someone has some new onset of back pain, taking some anti-inflammatories, addressing the pain, and moving better is a great way to start. And ultimately, maintaining function, so keeping about your everyday life and maintaining a positive outlook, recognizing that most back pain does not last very long. If it's not associated with any other health issues, you can take a day or two, apply these good low back first aid strategies. If you have questions, certainly reach out to a professional, somebody who's active in their approach to back pain, like at our office, Active and Conservative at Cold Pain Therapy Group, to get people moving better again, to help you meet your goals and move forward as quickly as possible. So think about having a plan. In your first aid kit, we've got some first aid supplies. In your first aid kit for back pain, we need a plan, or you need to have a plan. Consider now, what else do you need to learn? What else should you look into? Should you look into some lower back durability exercises, some spine sparing exercises? Do you need to talk to a health professional? What is it that you need next to have a really good low back first aid plan?